I'm currently one of the sports medicine fellows at the Stanford program in San Jose. My background is I did residency in family medicine at UCLA. I'm originally from Chile, South America, and did my medical school and medical training there, and then eventually moved to the US to continue my training as a physician. My initial interest was, of course, Dr. Blatz was part of our teaching program at Stanford. And the year I started fellowship, he actually was the year that coincided that he moved up to Portland to RestorePDX. And since day one, he was reaching out to us, offering teaching advice, life advice, career advice, kind of reaching out to us. He always kept like a good relationship with us. And then he had offered for me and my co-fellow to come up to Portland and spend some time with him at RestorePDX. And I of course was very excited about that because first of all, there was a genuine interest from him to reach out to us to kind of, it's rare that you get somebody to like, hey, come and I'll show you this and I'll teach you. It's usually you that you have to kind of approach someone, hey, I want to rotate with you and something, or you have to kind of do a little bit of work to get into rotations and stuff. So it was nice for it to be coming from him. And I also was really intrigued about all the regenerative medicine aspect of sports medicine that during fellowship we don't get as much exposure to. We get some basic approach to regenerative medicine, but not to the extent that I was able to have with my experience at RestorePDX. The teaching for one part of it was great. Dr. Blatz would stay with me even after clinic hours to kind of go over ultrasound skills, to answer any questions I had. He would leave good time between patients to kind of go over them. He would go over the images with me, and it was like a very good combination of seeing the patient imaging, going back to that, and then kind of looking at ultrasound and stuff like that. So it was very useful in my case as a fellow. A couple of patients where they actually recommended against doing any procedure, and like by fully like assessing the pain that they were having, kind of looking through the imaging, taking the time to do ultrasound. And at the end of it, what the conclusion was like, hey, I don't think this is the right path for you, which I thought that was also really good to see, that it wasn't just kind of thinking what things you could do for everybody. So it was good to have that other side of things. No, I think things that were really standing out to me was how I spent most of our time with Dr. Blatz, but how thorough he was with his patients. He would take a lot of time with them, kind of gathering the story, doing the physical exam, doing a comprehensive ultrasound. If they had an MRI, going through the images, like in a lot of detail with the patients, explaining every step of the procedure that they were going to offer to do. So it was a very comprehensive approach, and that's always kind of nice to see. And yeah, I mean, things also that stand out were things that I've never actually seen, like intraosseous procedures, which were very new to me in the non-operative world. And how I think all of the interventional, like lipo, BMAC, and PRP, it was great to spend time in the lab to kind of see how they processed all these specimens. And another highlight I would say was the BioSkill lab that we had. We had one session with the whole team at one of the surgery centers, and that was great because we got to practice with cadavers and ultrasound, and so it was really productive. So I enjoyed that too. different ways of looking at things, different approaches of what structures are involved in certain disease processes, what can they do to kind of restore as much as possible, not only just the meniscus, but the MCL, all the other structures, the gastroc, the semimembranous, and kind of approaching it in a comprehensive way, which I thought was a good approach too, which I'll actually be using a lot of that in my own practice, I think, after seeing all that, all their review of things. And yeah, I will definitely plan on using regenerative medicine in my clinic as much as I can, but definitely I think I have a skill barrier at this point in terms of going the other way of like full regenerative and kind of like the cool stuff that they're doing at Restore. But yeah, it's good to see, and also kind of see what kind of patients they actually that come in for these types of procedures who would be kind of like a good candidate for this. But yeah, it's probably not something in the short term that I will be able to apply, but for sure all the teaching that I got and the just basic review of imaging was definitely worth coming in for.